So today we are doing our own version of Explain Everything, which is all about multiple sclerosis or MS. Compliments to Kamla, Annie, Monique, Lindsay, and myself, Sarah. Alright, so first we will go over the pathophysiology, characteristics, and the patterns associated, which will then flow into causes, the many different signs and symptoms, labs and diagnostics, treatment, complications, and nursing diagnosis. So before I can explain the pathophysiology of multiple sclerosis, it is important to understand the mechanism behind the disease. So first we must understand the purpose and function of both the CNS, the myelin sheath, and the oligodendrocytes. So first off, the central nervous system, which I'm sure we all have heard of. Central nervous system, or CNS, functions as a processing center that transmits and receives signals sent throughout the body. This is done by the use of the spinal cord, which is the sender of the signals, and the brain, which receives and produces the signals. The nerve fibers are the actual pathway of these signals or impulses. To protect and speed up the transmission of nerve impulses, the nerve fiber is wrapped in a lipid-filled capsule-like material called the myelin sheath. The oligodendrocytes are myelin-forming cells that surround the myelin sheath and regenerate it when it becomes damaged. This is important to know because it is these structures that are affected by multiple sclerosis. Multiple sclerosis is an immune-mediated process that is initiated by activated T cells or lymphocytes that travel into the central nervous system from the systemic circulation. The CNS responds to this action by initiating the inflammatory response and eventually demyelination of axons, or breakdown of the myelin sheath. Destruction of the myelin sheath slows down the transmission of impulses sent to and from the brain. The oligodendrocytes that surround the myelin sheath can regenerate and heal the destroyed myelin coating, which would alleviate symptoms and the patient would be considered in remission. However, if the oligodendrocytes are affected by the inflammation, the myelin sheath will not be able to heal, leading to eventual loss of nerve function. Over time, the leftover damaged tissue is replaced with glial scar tissue, which leads to formation of hard sclerotic plaques. On page 1429, they give an awesome example of what would happen in different locations, like what symptoms would manifest. So depending on the location of these plaques in the CNS, determines the symptoms manifested in the patient. If located in an area of the CNS that affects elimination, the patient may experience constipation or issues with voiding. A common occurrence with voiding issues is a problem called spastic bladder, in which the patient experiences increased urgency and frequency. It is also possible for the patient to experience a flaccid bladder, which is the opposite, and the patient has decreased sensation and abdominal distension. Multiple sclerosis is a chronic, progressive, degenerative disorder that can be characterized by three pathological processes: demyelination, which is the breakdown of the myelin sheath, chronic inflammation, and gliosis, or scarring. Symptoms of MS are usually gradual and vague, occurring over months to years. And it's usually not diagnosed until a while after onset of first symptom, generally because people don't know that the symptoms they're experiencing are a disease process, so they kind of avoid going to the doctor. It generally affects people within the age range of 20 to 50 years, but occur in teens and older adults as well, and is 2 to 3 times more likely to occur in women than men. It is also 5 times more likely to occur in people from northern United States, Canada, and Europe in comparison to the tropical region of the South. This information can be found on page 1428 in your med searchable textbooks. Boom. Okay, so there's 4 patterns to multiple sclerosis, and it's basically just in describing the symptoms. So relapsing remitting multiple sclerosis, or RRMS, is the most common, 85% of cases. It's recurring episodes or relapses of the disease, and then I go into a definition of what relapse is, which is a sudden attack or exasperation of the disease. Increase in neurological symptoms. Attacks they're clearly defined and followed by periods of remission. And remission is symptoms of the disease where the disease disappears and no further progression of the disease. in each different pattern, they describe it by whether it's active or not active, so in relapses, so if the relapses are active or not active, and then with the disability, so if it's worsening, your disability is worsening or not worsening. The second pattern is primary progressive multiple sclerosis, which PPMS. It's characterized by gradual increase in neurological symptoms, no defined relapse or remissions, and then again, relapses are defined as active or not active, with progression or without progression. It's 10% of cases. The third is secondary progressive multiple sclerosis, or SPMS, characterized by initially relapse remitting, so it starts as the very first one, RRMS, and then progresses into SPMS. This is 50% of cases. Progression with or without occasional relapses, minor remissions, and plateaus. And the last is progressive relapsing multiple sclerosis, or PRMS, and this one is characterized by progressive disease from onset with clear acute relapses, continued progression between relapses as well. And this is 5% of cases. I found these pictures on the last three of the patterns helpful in understanding the different patterns of MS. You can find these on the National Multiple Sclerosis Society webpage. There's actually a link in the references at the end of this PowerPoint. There's also a helpful table. It's table 5913 on page 1429 in our books. This picture is a little helpful because it kind of keeps all the pictures on one page, so you can kind of see the differences in the symptoms.
Now for the causes of multiple sclerosis. The exact cause of multiple sclerosis is unknown. However, it is believed that 4 factors may play a role in the development of the disease. The 4 factors that play a role are immunologic, genetic, environmental, and viral causes. Now for the signs and symptoms of multiple sclerosis. With multiple sclerosis, you need to think sensory loss. With neurons, they help to provide sensory information, right? And the myelin sheath helps to support the travel of those senses, okay? So what happens is that the myelin sheath is lost as we begin to lose sensory abilities. You will notice that your patient will have fatigue, they will have tremors, they will have spasticity of muscles, because they are not able to transmit those impulses as well. They will have bowel and bladder dysfunction, decreased peripheral sensation, visual disturbances, and emotional instability. Again, we're thinking, just think sensory loss, because that's what we have to think about with multiple sclerosis. They will have decreased sensations to pain, temperature, touch, spasticity, and again, fatigue. They will not be able to control the movements of these sensations. And if you look to the bottom of the slide, you will find a link to a video that basically explains the symptoms of multiple sclerosis. Multiple sclerosis that people ignore.
Information regarding the labs and diagnostics of multiple sclerosis can be found on page 1429 of our MedSurg textbook. There is no definitive diagnostic test for MS. In order to be diagnosed with MS, the patient must have evidence of at least 2 inflammatory demyelinating lesions in at least 2 different locations within the CNS. They must also have damage or an attack occurring at different times, 1 month or more apart, and all other possible diagnoses must be ruled out. An MRI of the brain and spinal cord is useful in visualizing plaques, inflammation, atrophy, and tissue breakdown and destruction. Evoked potential responses are often delayed in persons with MS. This is due to decreased nerve conduction from the eye and the ear to the brain. In addition, cerebrospinal fluid analysis may show an increase in immunoglobulin G and the presence of oligoclonal banding. Currently, there is no cure for MS. Treatment is focused on the disease process and its symptoms. Initially, immunomodulator drugs are used to modify the disease progression and prevent relapses. Interferon beta 1b and glatiramer acetate are given subcutaneously every other day, and interferon beta 1a is given intramuscularly. For patients taking beta interferon, it is important to rotate injection sites with each dose. Wear sunscreen and protective clothing when exposed to the sun. Be aware of signs of depression and suicidal thoughts. And also, flu-like symptoms are common after initiation of therapy. Teriflunomide is used specifically in the treatment of relapsing MS. It is an immodulator agent with anti-inflammatory properties. For more active and aggressive forms of MS, natalizumab is given IV monthly when patients have had a poor response to other drugs. Corticosteroids work by reducing edema and acute inflammation at the site of demyelination, making them the most helpful in treating acute exacerbations. Many other drugs are used to treat the symptoms of MS. For example, muscle relaxants are used for spasticity, CNS stimulants for fatigue, anticholinergics for bladder symptoms, antidepressants, and anti-seizure drugs. Physical therapy and speech therapy improve neurologic dysfunction. Water exercise is an example of an especially beneficial type of physical therapy. Water gives buoyancy to the body and allows the patient to have more control over their body and perform activities that would normally be impossible. Exercise decreases spasticity, increases coordination, and retrains unaffected muscles to substitute for impaired ones.
Advanced MS can lead to many complications. Now let's look at some of the most common ones. Urinary symptoms of MS can occur because of disrupted nerve signals to the muscles that control the opening and closing of the bladder. As we can easily understand, when bladder can open or close properly, bacteria can easily invade, thus it can cause UTI. If you become inactive because of advanced MS, you run the risk of developing osteoporosis. Lack of weight-bearing exercise can cause your bones to lose density. Eventually, your bones could become so weak that they break. Steroid medications sometimes used to treat MS may also add to this risk. If advanced MS is causing you to spend too much time sitting or lying down, your skin can start to break down, leading to pressure ulcers or bed sores. These sores occur because constant pressure decreases blood flow to the skin and other tissues. The sore may start as a discolored area of skin and progress to an open ulcer. Common areas for sores are the shoulder blades, buttocks, and the heels. If advanced MS makes it hard for you to swallow, you may be at risk for having food or liquid spill into your lungs. This is aspiration, and it puts you at risk for developing an infection or irritation called aspiration pneumonia. This MS complication can cause choking, coughing, infection, and difficulty breathing. Depression is more common among people with MS, even those who have less severe MS. One reason for this is the stress of living with a chronic and unpredictable disease. MS may also have a direct effect on brain chemistry that leads to depression.
Some medications used for MS may add to the risk. First, nursing diagnosis. Fatigue related to decreased energy production, increased energy requirements to perform activities, as evidenced by inability to maintain usual routines, decreased performance. Nursing diagnosis 2. Self-care deficit related to neuromuscular perceptual impairment, as evidenced by inability to perform tasks of self-care, poor personal hygiene. Nursing diagnosis 3. Impaired urinary elimination related to neuromuscular impairment, as evidenced by incontinence, nocturia frequency.
Now for the nursing interventions. For those of you who are following, this can be found on page 1432. 1. Assist patient in identifying triggers that cause exacerbations. Exacerbations of multiple sclerosis are triggered by infection, trauma, immunization, childbirth, and stress, and also changes in climate. And these are different, as persons will respond differently to the triggers. 2. Assist the patient in dealing with emotions that come with the diagnosis. As a patient with recently diagnosed multiple sclerosis may need assistance with the grieving process. 3. Prevent major complications of immobility, such as respiratory and urinary tract infections and pressure ulcers. 4. Encourage early treatment of infection when it does occur. 5. Use walking aids when needed and review safety considerations. And 6. Manage fatigue, which is most common and persistent symptom. Now for patient education. If you are following, this can be found under nursing implementation on page 1432. Some goals for the patient would be maximize neuromuscular function, maintain independence with activities of daily living, manage fatigue, optimize psychosocial well-being, adjustment to the illness, and to reduce factors that trigger exacerbations, as discussed previously. Now for the teachings, you should avoid temperature extremes, learn and avoid factors that cause fatigue, teach them of the ways to avoid infections, the good balance between exercise and rest, also a balanced diet, which is a nutritious teaching on nutrition, increase fiber intake or increase roughage to avoid constipation, minimize caffeine consumption or intake. The patient should understand drug therapy and possible side effects associated. And there are support services such as the National Multiple Sclerosis Society.
Thanks for listening. Happy studying.